Hello, today I will talk about why should we stop seeking energy savings in summer energy poverty policies. My name is Carmen Sánchez-Guevara and I'm from the Technical University of Madrid. I've been coordinating Cooltorise project for 3 years and what I'm presenting today is based on what we have learned in these 3 years on working with summer energy poverty people and the way we should try to evaluate these projects and policies related to summer energy poverty. I will present briefly why we are presenting this shift of evaluation. I will talk briefly about how energy poor households face energy consumption and thermal comfort. I will go through the increased health impacts due to heat waves in the Mediterranean basin, and will present some proposals we've made for measuring the improvement of energy poor well-being and health. First, why? Because while other energy and housing projects typically evaluate their results by focusing on energy savings, projects aimed at reducing energy poverty require a different evaluation approach. This new perspective values also the improvement in households' overall well-being. Evidence-based recommendations are established on how the final impact of policies and expected impact from funded projects should be implemented for the correct adaptation policies for the population in energy poverty. I would like to thank projects as Empowerment and Well-Based that have joined us in this matter and have helped us set in these recommendations. You can find all the information in our website in Cooltorise and also the specific policy brief in which this presentation is based. You can find and download in this QR. We all know that when we address energy poverty, it is important to recognize that affected households typically face either excessive energy expenditure, such as spending more than double the median of their energy income, according to some indicators, or engage in restrictive energy use. These restrictions results into a lack of thermal comfort, which may imply several health impacts. According to the data from the EU statistics on income and living conditions, the most recent data shows us that around 9% of households in Europe cannot keep their home adequately warm. However, data we have from 2012, this was the only year they asked about whether households could maintain their house adequately cool during summer. We can see in this on the right hand side this chart in which we can clearly see that households declared or reported not being comfortable during summer, and that households reporting that were much more higher than those reporting not being able to adequately warm their houses during winter. So there's a huge lack of information of that, but it seems relevant. While winter situation is well documented, obtaining a comprehensive picture for the summer is more challenging right now. Also, we know there's a huge increase of health impacts related to heat waves in the Mediterranean basin. Health impacts are also, as before I said, they're extensively studied in winter energy poverty conditions, but they're not so studied in summer energy poverty conditions, even though we know that, for example, in summer 2022, over 61,000 deaths took place across Europe, and especially southern countries such as Italy, Greece, Spain, and Portugal. they presented higher heat-related mortality rates. So this has to mean something. Also, we know that air conditioning might be a solution, the use of air conditioning, but it increases emissions and increases the urban heat island effect. And we also know that urban heat island effect is one of the causes of summer energy poverty. So adaptation strategies and also the mitigation of urban heat island is key to decrease summer energy poverty. So it seems that increasing air conditioning or increasing energy consumption, it's not the solution. We also know that health issues comprises a wide range of problems related to mental and nervous system disorders, cardiovascular, respiratory, and kidney diseases. And also vulnerable groups include a huge part of the population, not only the elderly, but also individuals with pre-existing medical conditions, children, and outdoor workers. So based on this evidence, we prepare a set of proposals for measuring the improvement of energy pool well-being and health for funded projects, for example, or even for policies. First package of these proposals would be related to enhancing energy poverty project evaluations by prioritizing well-being and indoor comfort through improved energy and health certificates. This is a proposal. We could evaluate the reduction on energy demand through the energy certificates. And also, we propose developing a health certificate for buildings that would give us an idea of energy poverty conditions of the population living there. Or we propose even taking direct measures of temperature in dwellings to set thermal comfort thresholds and to understand thermal comfort conditions of these households. Another package would be evaluating heat resilience and summer well-being in households through enhanced data collection. We think that we should gather information about households' availability and use of air conditioning first, their capacity to reduce their heat exposure, such as access to cool spaces near their homes. Also, qualitative approaches have proven to be highly relevant, especially in evaluating summer energy poverty conditions, so they should be undertook in these projects, measurements through qualitative approaches, not only quantitative ones. And also derived from the consensual approach, we propose using or recovering the EU-Silk indicator dwelling comfortably cool during summertime. Another package of proposals would be incorporating well-being and thermal comfort indicators in European energy poverty projects. The reduction of energy demand and measure of thermal comfort should be incorporated. Also, the reduction of health risks due to inadequate dwelling performance. Additionally, we propose improving measurement the improvement in users' self-reported situations, as again connected to the qualitative approach, the reporting of households and how they feel and how they are able to cope with summer is extremely useful to understand how effective our policies or projects on summer energy poverty have been. And also, we should measure if there's an increase in access to better conditioned locations, such as climate shelters during summer. And the final and last package on proposals for better measuring these improvements, we propose enhancing databases, insights to address health inequalities and energy poverty. Address the health determinants and environment of the population is key. Also measure the impact of energy poverty reduction on mental and physical health. And also it's important building capacity among health workers and measure this if this has been effective. Build capacity among health workers to identify patients or cases of energy poverty situations to effectively derive them to other services. So thank you very much for listening. If you have any question, here you have my email and you can contact me and we can discuss more about these issues and on how to effectively measure the impact of summer energy poverty projects. Bye bye.